Hi, my name is David. I'm 53 years old, and I was diagnosed with a disease called FTD, which is frontotemporal degeneration. And basically, it's a form of dementia, and it basically means my frontal lobe is shrinking. And it's not a great disease. In fact, the life expectancy isn't great for it. There's no cure right now, and there's really no treatment. I think a lot of people, when they hear the word dementia, they think of like their elderly grandmother that's kind of in a long-term care facility and kind of sitting in a recliner. I'm not deaf, and I'm not stupid, but I have this disease, and it's really impacted my life in many ways. Having a mild cognitive impairment is a lot like, sometimes it looks the same as you know, someone that's had a few drinks, or somebody that's maybe hungover, you know, just not as sharp and you know, able to follow 3 or 4 directions at the same time. I really cope by trying to recognize those triggers and kind of avoid them. So I'm not a big fan of big crowds anymore. So sort of avoid the shopping mall when it's really busy, avoid places that are really loud. Sometimes I find it hard if we're with a big group of people and there's several conversations going on at the same time. I sort of kind of totally tune out. Help me.
You walk away.
I walk away. Yeah, I just walk away. Well, one of the nice things is I've lost my filter, so I kind of can tell people what I'm really thinking, and sometimes it can get you in trouble depending on what kind of social situation you're in. You know, some people take that as sort of a lack of empathy or lack of understanding, but you know, it can be probably confused for kind of antisocial behavior, which I'm sure police officers deal with all the time as a big part of their job, and you know, recognizing that as a disease as opposed to, you know, just somebody being irritated is probably a challenge. Sometimes I'll just speak out random words. I'll use the wrong word, usually connected, so I'll say apple when I should be saying orange, or I'll say fridge when I should be saying microwave. My brain's trying to grab a word quickly, and sometimes I just keep going with the sentence with the wrong word. And you know, usually my wife is good and she just lets it go, but if you weren't used to that, you would look at me and think, you know, something's off with this person. They're not coherent. If I had to talk to a police officer, it would probably be best if I was in a comfortable setting, you know, without bright lights and being in an uncomfortable chair. I'd probably be more forthcoming and more relaxed and more able to communicate, as opposed to feeling anxious and agitated, where I would probably shut down and not be able to have that discussion. I think the best way to communicate with someone that has dementia is just to be kind, to be patient, you know, if the person is agitated, to try to remove them to a safe place. So, you know, if the person is agitated in their surrounding that they're in, sort of move them to a quieter place. But I think just being patient and kind. It's really tricky because not everyone has the same reactions, and I've noticed that from meeting other people that have various types of dementia, and including Alzheimer's. You know, some people get agitated very easily. Some people can't, if they hear a command, so if a police officer gives them a command like walk over there and sit down on the sidewalk and take your wallet out, they might start walking and keep walking, right? Because they can't process 3 commands at the same time, and it confuses them. So it's I think education of you know, emergency responders, police officers, firefighters is essential to recognize that you know, there's a lot of people out there that are struggling with this, and it's not all memory loss. It's not all old people with Alzheimer's that, you know, you wouldn't have a conversation with because, you know, they're not going to respond at all. So my diagnosis is not, my prognosis is not spectacular. You know, one of the humbling things is being told in your late 40s that you have to get your affairs in order, you know, financial matters, your will, because the form of dementia I have is pretty well fatal, and there's no cure currently. So it's you know, it's a bit like the death sentence.